You're an intern, aren't you?
Yeah. Yeah, I'm an intern.
Well, you all look like barbers.
I first got interested in medicine because of some TV shows in the early 60s. One was Dr. Kildare.
Just for the record, next time I don't want any lousy interns sticking me, you hear? I want a doctor.
The other was Ben Casey, which was about a neurosurgeon. I knew from the time I was 9 years old I wanted to be a doctor.
Neuro-oncologist Henry Friedman is regarded as a brilliant and compassionate doctor and researcher who is deeply driven to find cures and give the best treatments possible to each of his cancer patients. He is internationally known for his pioneering work to treat glioblastomas, the most aggressive and deadly of all brain tumors.
They've already spread over the entire brain at diagnosis. They may be in places of the brain where they can be grossly removed, but never microscopically, or they may be located in parts of the brain where you can only do a biopsy.
His success treating glioblastomas is so encouraging that in 2002, CBS's 60 Minutes dedicated 2/3 of a full show to Dr. Friedman and the work being done at Duke.
Dr. Friedman also uses a highly unorthodox and aggressive combination of drugs in a last-ditch effort to save those who have not responded to any other treatments.
It really took us from a very acclaimed national center to internationally acknowledged.
Several years later, Dr. Friedman showed that the drug Avastin has potential benefits for treating glioblastomas, and it was approved by the FDA for that use.
Glioblastomas was considered a death sentence. No question about it. And even still, it's really very sad, but a patient comes in with a malignant brain tumor at some very reputable institutions around the country, and they're essentially told, you're dead. Just that simple. Henry is probably the person in the world who is most responsible for saying, hey, there's certainly room for treatment of glioblastomas, and there's certainly hope.
Dr. Friedman was born and raised in Queens. He earned a bachelor's degree in biology from the University of Rochester and a medical degree from Upstate Medical Center in Syracuse, where he also performed internship, residency, and a fellowship in pediatric hematology oncology. At Upstate, he worked with renowned hematologist Frank Oskey, at one time focusing primarily on red cell membranes.
I hated it. And I went to Frank and said, Frank, I can't stand this. I don't want to do this anymore. I want to do oncology. And he said, all right, if that's what you want, you're going to do brain tumors, because if you do anything in brain tumors, you'll be doing something nobody else has ever done.
He transferred to Duke in 1981 as a senior research fellow in pediatric hematology oncology. The reason he came to Duke, he says, was clear.
It had simply to do with a woman. Joanne came down in July of 1980 to continue her training, and I followed her 6 months later.
The Joanne he followed is his now wife, Joanne Kurtzberg, a Duke star internationally known for her pioneering work with umbilical cord blood transplantation. They both joined the Duke faculty in 1983. Dr. Friedman is known as a dedicated and caring mentor to future oncologists. He also is co-founder of the Duke CAPE program that takes promising undergraduate female athletes and puts them on a track for exploring careers in medicine.
I really felt that we needed to do something to help bring women to the leadership roles of medicine.
His own mentors at Duke were John Falletta, the division chief in pediatric hematology oncology, and Darrell Bigner, the head of the neuro-oncology program.
John Falletta was an excellent leader, gave us the ability to develop in the directions we wanted to develop, and gave us the ability to really fly when we were ready to fly out of the nest. Darrell Bigner has been with me, guiding me from the very beginning, and still to this day guides me.
Dr. Friedman and world-renowned neurosurgeon Alan Friedman are co-deputy directors of the Preston Robert Tisch Brain Tumor Center at Duke. Together with Dr. Bigner, the director of the center, they form a powerful triumvirate in one of the most advanced brain tumor centers in the world.
We've been portrayed as figures from Star Wars, which I kind of like. I'm clearly Luke. Darrell and Alan have to claim their own roles here. I'm not sure either of them wants to be Yoda.
He and Joanne have a son and daughter who both are Duke graduates.
Like most men, especially anyone in this room who has the courage to admit the truth, I married up. I recognize that. I like to go to sporting events, Giants football games, Duke basketball, of course, and basically have a very sports-oriented, exercise-oriented passion to my life.
And mostly, he'll continue his tireless fight to find a cure for glioblastomas and other brain tumors.